Minister, Mary Barkley Meehan lost her husband during the COVID period in the Kilbrew nursing home, and also her son in a 6-week period. Ulton had dementia, he had carcinoma cancer, which resulted in tumorous wounds on his face and head, and he had been a resident in the nursing home since 2019. Mary was shown a video shortly afterwards. In that video, it was quite horrific. The side of Ulton's face was discoloured with black congealed blood. His nails were long and they had become black as well. And unknown to himself, he'd started to pick the facial tumours that he had. And as a result, these facial tumours became infected. Shockingly, his face had become infested with maggots. And shortly after these horrors happened to that man, he died in the nursing home. Months after all that happened, Mary obviously had gone to the Department of Health, gone to HIQA, gone to the HSE, seeking for an investigation and for justice for her husband and her son. And all of those groups said that they refused to investigate properly what had happened to her husband. It's 4 years ago now since Mary's husband died, and it's actually, I think, 4 years ago today since she last saw him before he died. Now, I spoke to her today, and she said, shockingly, every second night in her dreams, she has nightmares of that infestation currently. And she said to me today, she said, "I hope I don't die before they say sorry," is what she said, which is an horrific situation for anybody to have to deal with. To have gone through a situation where loved ones were so poorly looked after in a nursing home at a significant cost during a very, very difficult time, in a time where she was prevented from being with them and protecting them and holding their hands and, supporting them through their final days. And then to have the state basically wash their hands of it and say they weren't able to help. And I do think it's astounding that happened. Now, I would like to know, and maybe your bill does start to step towards a situation in which a situation like that can be investigated in future, and maybe you might answer that in your reply at the end. But I did speak to the Ombudsman's office during that period of time, and I asked them, would they investigate what happened to Mary's husband? And they said they couldn't. They said they simply did not have the power under the law. They had no ability to investigate what happened. And I think that's incredible as well, because we do see the Ombudsman as the last port of call for citizens to be able to investigate the public delivery of services in this country. And the Ombudsman actually stated that unless there's a change to the Ombudsman's legislation itself, they won't be able to investigate something like this. And I think while we're changing this legislation, and there's two pieces of legislation being amended for this particular bill, I do think that we should be looking to also change the Ombudsman's legislation as well, to make sure that in future the Ombudsman's office would be able to investigate in relation to that. It is absolutely wrong what has happened to Mary Barkley Meehan. It's absolutely wrong what happened to her husband, and also what happened to her son. It is absolutely wrong that there has been no investigation, no apology in relation to what happened there. And I still would implore the Minister at this stage to see if there's anything that can be done to achieve justice, and anything that can be done to make sure that Mary Barkley Meehan does not pass away without even receiving so much as a sorry from the state in relation to what happened there.
Mrs. Barkley Meehan.
Well, I appreciate that. I do appreciate that, but I would ask for maybe if you might meet again, and just to give that sorry to her, because I do think that's an important thing to happen for her at this moment in time. I do think that the whole situation around the COVID crisis and the nursing homes was an incredible situation. 2,323 people died. 27% of all deaths during COVID happened in the nursing homes. They were the ground zero of COVID in actual fact. The government moved thousands of people from hospitals into nursing homes. Many of them weren't tested for COVID. It had the effect of seeding COVID throughout the nursing home sector, which inevitably led to significant numbers of deaths in those nursing homes. Staffing in the nursing homes were absolutely chaotic. Nursing homes at the time were reporting to me they were being abandoned in terms of the staffing. A nursing home in Galway had all but 2 of their staff test positive for COVID at the time during that outbreak, where they saw 5 residents die. And I remember, that manager of that nursing home being on RTE radio in tears, crying that he had no ability to get the necessary staff, and the HSE saying to him that that they had no staff available. I remember other people getting phone calls from nursing homes, asking them to come in and feed their loved ones. Other nursing homes going to Facebook and putting up posts to say, can anybody come in and help us during that time? And, I also remember a Freedom of Information request, which showed that the CEO, Paul Reid, at the time, did not respond to your request, Minister, to deal with the lack of staffing for about a month. Which I thought was an incredible situation. He also didn't respond to Phelim Quinn of HICWA in time for at least a month in relation to that. And also Nursing Home Ireland seeking a meeting with the Minister for Health, Simon Harris, at the time, with no luck whatsoever. And the Minister for Health, who's now the Taoiseach, creating this big, this big press statement of a response, the Be In Call for Ireland, where 77,000 people were asked to come and help this massive fight in terms of, staffing our hospitals and nursing homes, and only 400 people being employed out of that, which is absolutely incredible. I want to give credit to Majella Beattie and Care Champions for the hard work that they've done in trying to get an investigation into this too, and the hard work that they've trying to do to make sure that family are able to accompany and support their loved ones in nursing homes in the future. And I think that needs to be a basic right for anybody in a nursing home and anybody who is a loved one or a family member of somebody in a nursing home. I also want to mention the fact that they're fighting currently for residents in the Cherry Orchard Hospital, so that they won't be coerced into transferring to other locations there. And again, I'd ask the Minister to intervene in that situation if possible. I also want to say that right now, I understand there's about 50 families that are suing the state through the state claims agencies for wrongs that were done to their families in terms of during the COVID time. I think it's incredible that there's still no state investigation into what happened in nursing homes during COVID. I think it's just incredible. I met with the former Taoiseach Leo Varadkar in government buildings along with other political parties to discuss their plans to have a review into this, a review that wouldn't have the ability to compel people or papers, that wouldn't look to speak to the former Chief Medical Officer, the head of the HSE. How you could not include those people into an investigation of what happened during COVID, I don't know. I think it's absolutely incredible. I think it's incredible as well that all the political parties here, even from the left and the right of myself, agreed with the government's plans until we piped up and said, no, there must be compellability in terms of people and papers, and then only some of those parties rode in to support that objective. There must be an investigation. Now, I honestly believe that this government don't want an investigation into what happened during the COVID crisis. They will do everything they can to stop it. I don't believe we'll see one in the lifetime of this government. I do believe that this government would like to cover up many of its actions in relation to what happened in the nursing homes and what happened in the hospitals during the COVID crisis. I just think it's incredible that we see in the north of Ireland today the British state are involved in an investigation into the COVID crisis. Most other European countries have involved themselves in an investigation in what happened to the COVID crisis. We don't even have the terms of reference yet from this government. We have no plans at all into an investigation there. And I think it's a major injustice in relation to what happened to the 2,300 people who lost their lives in the nursing homes during the COVID crisis. It's a major injustice. And secondly, what it means is that the state has learned nothing yet in relation to how to deal with such a crisis if it were to happen again in the future. And that is the purpose of a state properly investigating what happened, so that it can learn from the mistakes that it made, that it can actually put in place new policies, new procedures to make sure that those mistakes do not happen again. And I think what we need is, and I would like to see from yourself, Minister, a commitment to a full public investigations with the power to compel people and papers in the future. I think that would send a clear message that the government means business, and that the terms of reference will be published before the end of this government. If you were to say that here today, I think that would be a very, very important step for the families. I also just want to say, I do welcome that there is legislation happening here. I do welcome that this legislation is starting to look to increase the oversight in relation to what's happening in nursing homes. I do believe it has to be far stronger, to be honest, Minister, and we will be putting up amendments to strengthen that in the future. But before I go, and I've only a minute and a half left, I do want to mention that nursing homes are in a state of chaos in this country. And that is a fair statement to make, because we've seen 50 nursing homes close over the last 4 years. We know that the bed capacity in this state is currently not sufficient for the population that we have, and that we are going in a demographic trajectory which necessitates the trend not to be the closure of nursing home beds, but to be the significant opening of nursing home beds at the moment. I do want to agree with Deputy Shanahan in relation to this, and that I actually believe that the bird will only fly on two wings in relation to this, that it will need public delivery of nursing home beds, but it will also need a private sector that is actually delivering into the system as well. People would far more like to debate the ideological surroundings of this issue than actually the practical elements of this issue. It's like, I wanted to climb to the top of Mount Everest, but they don't even talk about the base camps that need to be achieved before that. The extra provision of nursing home beds, whether it be public or private, is necessary now. And I really appeal to the government to make sure that the provision of those services are feasible in terms of the funding that's available for those services, and that actually the staff in those services get paid a proper income, because we hear too often that staff can't be achieved for these services. Well, the first thing you do if you want staff is you make sure that they get proper paying conditions, and then they will come. Gaur Magat.